Police in South Carolina are investigating a mass shooting that killed 4 people.
Joan asks, when someone is injured in a mass shooting, are they responsible for their medical bills? Here's Victor Puente with the answer to that good question.
Well, that is a possibility. There is no clear-cut answer when it comes to who pays the bills for a shooting survivor. Each circumstance is different, and it may depend on where the shooting happened, the insurance of the victim, and how bad their injuries are. A report from the Association of American Medical Colleges says more than 80,000 people each year survive firearm-related injuries. And there may be costs beyond the initial visit to the hospital, with some victims requiring pain management and psychiatric care for years after the shooting. As for who pays, there's a long list of possible outcomes. The victim's insurance could be on the hook for a lot of it, with the injured person paying for part of it. If the shooting happened at a person's workplace, workers' compensation and their employer's liability insurance could cover it. Now, there are programs meant to help crime victims, like the Crime Victims Compensation Fund program that's in Kentucky. Quote, the Crime Victims Compensation Board decides compensation claims from survivors of violent crimes who have no other resources to pay for the medical, funeral, mental health counseling, and dental or corrective lens expenses resulting from the crime. Taxpayers, though, also pay a lot of those costs. A study from Stanford Medicine showed that between 2010 and 2015, Medicare and Medicaid paid almost $2.5 billion related to firearm injuries. And in some cases, where patients were uninsured or self-paying, hospitals would end up absorbing the costs as uncompensated care. If you have a good question, just email us, goodquestion@wkyt.com. I'll see you on WKYT Mornings.